This presentation was first delivered in December 2020 as part of the Time to Change Employer Masterclass on the intersectionality of mental health and diversity in the workplace. We hope you find it useful. Screen share.
Yeah, thank you so much for that lovely welcome. And it's great to be with you all here today and be part of a Time to Change event, which not being part of a big employer, I haven't had the opportunity to do for a while. So it's lovely to be here and be your last masterclass as well, which is bittersweet. So thank you, wonderful to be here. Just wanted to pick up on a few things. I don't want to revisit housekeeping, but just really that we're all at different stages. So that's okay. We're all on a journey. We all keep learning in this area. And so some of the things might feel uncomfortable. Pleased that we respect each other's views. And that's not just in this virtual space. Maybe you won't have a chance to speak to each other, but thinking about after this as well. And if you want to challenge me, please do so. I just ask that you do it professionally. Use the chat, bring your own experience to the discussion, because I know there's a wealth of experience in the room. That hopefully this masterclass is about helping people, helping you as delegates to embrace new ways of thinking and doing things, and also to hold yourself accountable and be ready to take action. So it's great to attend things, but what are the tangible actions from that? So just keep that in the back of your mind as well. So we're going to cover a bit about the pandemic, of course, and its impact in the workplace, really defining what do we mean by equality, diversity, and inclusion, because these are words that are often bandied about, but what do they really mean? How mental health recovery, because we know recovery is always possible, but of course it's impacted by our own culture and our own cultural lens. Aspects of diversity and making workplace mental health support more inclusive, thinking about what that looks like, and consider actions to take forward to improve support for all staff. So then, first of all, starting with these terms, equality, diversity, inclusion. What do these terms really mean where you work? And I know with equality, there's been a lot of talk, and this does the rounds quite a lot when the subject comes to the forefront, of the three individuals who need boxes of different heights, one who doesn't need a box, to see over a fence to see into, I think, a baseball game or a football game. So in that context, what might equality mean? Is it about treating everyone fairly, or is it about really equity and enabling people to have an equal experience by making adjustments? Diversity, again, I think diversity is used as a proxy for lots of things. Sorry, diversity, it can be used as a proxy for many things. And I think one of the things is diversity is simply difference, right? So difference, lots of different people, different perspectives, different backgrounds, and therefore different thought processes. And then inclusion. Well, inclusion is really about how do people feel like they are part, that they belong. And I know the word belonging can also have some negative context around it. So sometimes when I use the word belonging, people say, well, does that mean does your face fit or not? But really how people are included and how much they want to be included. So just thinking about what those terms might mean where you work, and it might be that diversity is spoken about without the other two principles. And of course, there's things in between as well. And I just wanted to share a definition with you. And I've adapted this from Inclusive Leadership, which is by Claire Sweeney and Fleur Bothwick, who you might know from their book that was published in 2016. And it says, they say about equality is being invited to the meeting. And what I would add to that is to make sure that that invite is accessible. So how is that meeting invite being sent? What time is it being sent? Who is it being sent by? Is it accessible with screen readers and formats? Does someone come and talk to you about that invite and encourage you to attend? So there's also that. Then diversity is about lots of different people or difference being present at that meeting. So having a seat at that important meeting. And inclusion is about sharing your views uninterrupted and not being spoken over and being heard. As this one delegate recently said to me as well, it's not just about being uninterrupted and being heard, but what then happens with the information that you share to make things better. And I thought that was also a really crucial point. So I wanted to set the scene and give a framework around this, because I think these terms can mean different things to different people. But this is really, for me, how I see it. So if we think about champions, who's asked to be a champion? How are they asked? How are they encouraged? Do you have a diversity in terms of age, in terms of ethnic backgrounds, cultural backgrounds, length of service in a particular organization that reflect the organization, and how are people included? How are all champions' views included? Same with policy reviews. If they're particular policies and we want to look at them through a mental health and well-being lens, how are we talking to those people? How are we making sure that they can share their views, be heard, and those views be integrated into those policy updates and changes? So equality, diversity, inclusion, and mental health. Now, this is, of course, we're not just one facet, and will be lots of different aspects. So if we take age, for example, our age, of course, will change. It changes every single year. We might then go into a different bracket where we have to tick our age on a box. So age impacts how we might see mental health, mental ill health, recovery, how that's changed from generation to generation, but also how with age we might experience different mental health, mental ill health, and different stages in our life. Then we've got disability. Now, of course, in terms of the Equality Act 2010, we know that mental ill health is covered in the Act. But I'm not saying that having a disability in and of itself means that you have mental ill health, but it's about the way in which people will experience barriers, right? So how someone can access things, how someone can live the life that they want to live, how someone can participate and be part of the workplace, which is often very, very difficult. And we also know that there's going to be a difference between acquired disabilities and people who are born with disabilities and the support they may receive or knowing what they need. So that's all feeds into then how someone's mental health journey shapes and how we need to think about mental health support in the workplace. And then gender and also gender identity. So again, I'm not saying that it's gender in and of itself. We know that the male and female brains, there's no difference. But again, we go back to the societal statuses, the pressures, the norms, what's expected of people. We know phrases like man up contribute potentially as part of a wider picture to men experiencing or men dying more by suicide. We know that the rates are 3 to 1. We also know that women are far likely to be carers for elder dependents, younger dependents, but also mopping up the pieces when men do take their own lives or die by suicide. So there's a whole lot in there. And then gender identity, gender fluidity. It's very tragic within the trans community how there's also an increased number of suicides due to society and prejudice and discrimination. Then we've got LGBTQIA, so lesbian, gay, bisexual, trans, queer, intersex, allies or asexual, the A can stand for plus perspectives, and thinking about people's coming out journeys, how they're accepted. And we can link that back to age as well, because of course, depending on what age someone was when they came out and where society was, of course, that's really going to impact mental health, well-being, how they were able to do that, connections with family, not having a connection with family, being able to express themselves, bringing their true selves to work, and how accepted they feel. Religion and belief. So, thinking about how religion can be a help for some people, a hindrance for other people, beliefs, whether they're political or other beliefs that are prescribed around mental health, mental ill health, and how that will shape someone's recovery journey. And pregnancy and maternity. So, again, this is a really interesting one from a cultural perspective. And I remember running a program actually at Imperial, and there was a delegate who was from Colombia. And she said, "That's ridiculous because when you're going to have a baby, you're really happy. Why on earth would you have mental ill health?" So that's an interesting cultural perspective. And of course, we know that everyone will have a different pregnancy journey. There'll be factors around pregnancy, whether it's planned, unplanned, a surprise, wanted, unwanted, and those things around then how that will impact mental health and well-being, and in particular around finances as well. So how that might impact whether people are prepared. And of course, it's not the pregnancy in and of itself necessarily, is it, for everyone? Everyone will have a different hormonal journey, etc. So there's a lot. And of course, we're not just one aspect. So we'll have an age, we'll have a gender, we'll have a particular religion or belief, etc. So it's about thinking about that whole person and the experience they bring within the workplace that could be really helpful, but also thinking about what are the ways in which we're talking to our employee assistance program and discussing these things. So if people come forward for counselling, that the EAP that we work with has those counsellors and support mechanisms that are also thinking about this. And of course, our mental health is really tested. So all of us will have experienced ups and downs when things that we haven't planned for come forward. So we know that the pandemic is absolutely testament to this. Working at home overnight, for some that have been brilliant, for others, oh my goodness, not being able to see friends and family. And I speak for myself here as an extreme extrovert. This is a real challenge. Not being able to chat, travel, disruption to routines. So lots of us didn't love the commute, but what it did do is give many of us that ring fence time to read a book, listen to a podcast, and just get ready for work. Global grief, which is sadly still continuing, video call burnout, and this particular wave of Black Lives Matter in June 2020. Now you'll see I didn't have race on the previous slide because I'm going to talk about that a bit more, but in particular with Black Lives Matter, it wasn't just about this particular wave. We have to think about the fact that Black Lives Matter is actually about 600 years old. We think about the forced movement of people, the transgressions, the brutalization, the video that was out there, which I haven't watched, but the brutalization, as Clara Amfo from Radio 1 put it, of another Black body. And how also many Black staff and colleagues were actually made to feel responsible for educating others about it. So there was all of that as well, and that has a huge impact on people. And many people who had not really thought about racism or systemic inequalities sitting up and thinking, oh my goodness, I've never really thought about how having a skin color, being a person of color really impacts people. And then, of course, I just wanted to share a little bit about the adaptation cycle. So, how our energy levels and emotions have kind of adapted or not adapted. And I think we're probably going through these stages, not necessarily sequentially, but up and down. So, maybe when we were told that we had to work from home, we weren't coming into the office, we had initial anxiety and relief, like, oh, how am I going to do homeschooling? Oh, actually, I don't have to commute. Oh, I can spend more time walking my dog. Oh, I'm going to miss my colleagues. You get the idea. Then the honeymoon stage, and that could have been increasing levels of emotion, positive emotion. Oh, great! I can come down the stairs at 8:30 or sit at my desk at 8:30, and I don't have to feel rushed. I can take lunch breaks, etc. Then we had the process of adjustment. I'm quite tired of this now. I miss my colleagues. A bit tired of working at home. I just see these four walls. A bit tired of social isolation. And then maybe, uncertain anxiety, some of you might have gone back to the office for a period of time. So thinking, oh, how am I going to do the commute? Do I feel safe? Is the office truly COVID safe? And again, if we think about those who are caring for people with, who are shielding, for people with long-term health conditions, if you have, anxiety or developed anxiety, that would have been really, really tough. And then a process of integration, and we're getting different information all the time, and stories about how COVID is affecting Black communities, but global majority diaspora communities. Thinking about that, some people don't have the choice to work at home, so all of that is going on. So again, thinking about socioeconomic backgrounds, how that's going to impact on someone's mental health journey. So just some other things I wanted to mention. I think I've mentioned a few of these, but binary versus non-binary, thinking about the construct of gender and gender identity. I've mentioned homeschooling and who takes responsibility of that in the home, particularly for single parents. This was a real challenge. Financial inequity, digital poverty, how do people connect? Also, many employers weren't really giving their staff the right equipment. So that's been a real challenge. Space issues, how do you create space? I know many people living in shared accommodation were sharing a kitchen table, and there were some people on sales calls, other people trying to do coding work, and it was very, very difficult. Maternity leave, so there were employers forcing staff to take maternity leave early when they shouldn't need to, and saying, oh well, you just have to start your maternity leave early. And of course, pension gaps as well. So if we think about furlough, we think about the redundancies, pension gaps have a huge link then with age, socioeconomic, and we know there's a gender pay gap. There is absolutely also a pension pay gap. So a pension, sorry, not pay gap, a pension gap. I've talked about that. I've talked about some of these disabled women or disabled people having, being punished via systemic barriers as well, if they are carers and then they're managing long-term health conditions. Huge pressures in the creative sector that haven't gone away. I don't want to be negative about the healthcare system we have in the UK because it is amazing. But when everything went on shutdown, and many of you might have seen, particularly around eating disorders, there were many eating disorder campaigners on Twitter saying, my lifeline's now gone and my coping mechanism is to go back to my eating disorder, if you like, and that is my comfort blanket. And without my community or my therapist, this is really difficult. So recovery is frozen and it's been put back on me. Not being able to get the medications, and I think that's going to be quite tricky now going forward with Brexit as well, and how medications, it might be the same in terms of chemicals, but actually when the medication changes in terms of brand, there are slight differences and people have to readjust again. Lots about long COVID too. So women are more likely to suffer with long COVID. There was an article that came out a few months ago, and I don't know if anyone listened to Radio 4 this morning, but there was a story about a really serious long COVID case and someone has been left with permanent disabilities. So the family has had to adjust and adapt, and think about how they're going to manage going forward. And if we then think about societal barriers and that person can't interact and do things the way they used to, of course that's going to have an impact on mental health and well-being. And just a bit more on racism then specifically. So depression, of course, it makes sense, is linked with racism and racist experiences. And young Black women actually have the highest rates of self-harm in the UK. So there was a study that was done 10 years ago that showed that, or I think 8 years ago. And also the way it's expressed or the way in which the self-harm might be carried out. So thinking about champions, thinking about having conversations, how you have those conversations. It's not a one and done, it's about that continual, and with certain communities, especially if they've experienced hardship, discrimination, they may well be less likely to open up because of this, the fear of what's going to happen to this information. So how do we have those conversations? Global majority communities, and by that I don't use BAME anymore, but I do mean BAME. So Black communities, Asian communities, diaspora communities are less likely to access support and receive appropriate care. So much like we've seen with the health outcomes for COVID, we absolutely see that with mental health and mental ill health recovery. So thinking about, well, what could we do in-house to talk about the mechanisms and to encourage people to get help, the way we do that messaging, and also the conversations again with the EAP, or are you going to partner with specific third sector services that could help with this? Having a lived experience of racism increases empathy and understanding. So going back to our diversity, sitting around the table, this is why it's so crucial. They can help us see the unknowns and enable us to, illuminate any things that we may not have been aware of. Again, it can be very difficult to detach, particularly if we are from communities of colour, so we might feel like we're walking away and we don't care. So having really good mechanisms so it doesn't just rest with a champion and there was a wider shared understanding about this is absolutely crucial. And just a little bit about the iceberg model in terms of stigma, in terms of recovery, in terms of how we keep the conversations going. So any organisation will have the observable, so the outcome, so the results and the behaviors, so our habits and the results that we produce. But of course, feeding underneath that, we've got beliefs and values, which may not always be obvious. Yes, there'll be the mission and vision statements that organizations put, but what about, it's not always, the actual intrinsic values aren't always visible. Then the thinking and the emotions, and I think particularly for UK workplaces, the emotions can really be under the surface. Now, we'll have this in our workplaces, in our teams, And we'll also have our own iceberg. So our own culture is going to feed this. So we all bring our own iceberg to this overarching organizational iceberg, and thinking about where they align and where they misalign is super important. As to how you bring people on board, how you review policies, how policies are developed, because they are not colorblind. People might think, or EDI blind in effect. There will always be seen from a particular stance or nuance. So it's really important to have those people round our table to make sure that they're included, so we have the best policies and procedures to affect and change behaviors and see those better observable results for everyone. And then culture, like with our iceberg, we all have a culture. Yes, there'll be certain cultures that are dominant. So whether it's masculine culture, whatever, however we define that, whether it's white cultures, what are the normative cultures? We'll have a different perspective on mental ill health and also mental health and recovery. So, for example, psychosis can be seen as a calling in some cultures. So, a calling or hearing voices from a higher being. Religion, as I mentioned earlier, could be seen as a help or a hindrance. Of course, they're not viewed the same globally. And it could be that someone has been raised in Britain, of course, but they also have a second or third culture that informs their viewpoint on mental health and mental ill health. And practitioners, there are actually very few practitioners that have deep cultural understanding of cultural nuances. And if we think about universities and the number of Southeast Asian students that are recruited to UK universities, when it comes to counselling and support, they often don't meet the level of requirement that those students need, and the way in which, for example, Southeast Asian Chinese culture in particular is very collectivist. So it's not necessarily about that one-to-one interaction. So we've got cultural stigma, and that's around how people are stigmatized, what that stigma looks like, who then gets put in in-group and out-group. If we then move to explanatory models, that's all about how do we explain away or explain mental ill health. In some cultures they talk about the evil eye. The evil eye has found you and got you, that's why you have mental ill health. It could also be, they work too hard, that's why they've got mental ill health. How are these things explained? And then bottom left, we've got cultural isolation versus cultural support. So if someone from a particular cultural background, as defined by them, feels very isolated by their culture, their recovery journey is going to be impeded. They're less likely to feel able to talk about it. We know talking is one of the most important things. They're less likely to access support, and they're more likely to hide things. Whereas if someone gets cultural support, they're going to feel included, they're going to feel heard, they're more likely to get support. And if that support doesn't maybe match their needs, to go and look for it elsewhere. So there's that real pathway to a recovery journey. And then cultural pride. So if someone feels that they've seen someone from a similar background to them come through and talk about their recovery journey and you know live the life that they want to live, they will also say, wow, if that person can do it and I can connect to that, then I can also do it. So there's a real piece about cultural pride there as well. Many of you might be familiar with this. So this wonderful time to change stigma, we've got it mapped. And just to say really that there isn't, and this is a snapshot of a few countries, but that every single country will have a perspective, restrictive law, banishment for people from their country or other countries around mental health, mental ill health. So you can just see a snapshot there. I won't go into it, but banning people, over medicalizing mental ill health, connection with danger, connection that they're going to spread it, that there's mental ill health is a contagion. So these are all going to feed into people's perceptions of themselves, how they need to be supported, and what they need to do for their recovery journey. And so just to think about, and feel free to type your thoughts in the chat, but what might be challenging about your own expectation of mental health recovery and mental health in general and that of others? So what would we expect if someone becomes mentally unwell for a period of time? Do we have any expectations about what a good recovery journey looks like, what they should be engaging with, what's going to be most helpful to them? So just have a reflect on that. And then I just wanted to share with you, if I've got some time, yeah, I do, the action model. And this is, so it's really about microaggressions. So microaggressions are when it could be unintentional or it could be intentional. People create a hostile, degrading, or prejudicial environment through their words and actions. So it could be inappropriate questions, for example, to women, when are you going to have a baby? And you don't know someone's fertility story, their fertility journey, their wants in life. Things like, does black skin tan? Does Asian skin go pale? Completely out of context. Could be questions, could be statements. So I'm sharing this with you because often other people in our organization may not understand why we have to take this broad lens view, thinking about mental health, mental ill health, recovery, policies, champions, etc. And it's also, I know, really easy for me to talk through this model when I haven't got someone that said something that I don't agree with, that's upsetting or untoward in front of me. But I hope it's useful to you, and it's really for you to take and adapt and think about what's going to be useful in this and how do we call out negative behavior, but also how can we really get people to understand that a broad perspective on this is absolutely essential. So the A is first for asking questions, checking understanding and asking an open question about a comment. So let's say someone had said, does black skin tan, as an example. A question we may ask is then, I found it really interesting, or I'd really like to know, when you said, does black skin tan, what made you ask that question? And we want to try and flip the why question to a what, because often why can come across as judgmental, even though that's not the intention. And then it's to listen. We all know about listening non-judgmentally. It's one of the most important things that we do. One of the most important things we do as champions and mental health activists. And then you would listen to that and tell them what you observed. So I noticed when you asked that question that our colleague really flinched. Did you notice that? Or what were your thoughts about that? And to really listen to that. And then the impact exploration. And that would be something like, what do you think the impact on them was when they heard that or when you said that? Or if someone had asked you that question and you were one white member of staff in amongst staff that weren't from your background, how would that make you feel? And then owning your thoughts and feelings around the impact. So I think the effect of you saying that was that they switched off. They didn't want to engage, and it was very hurtful because the question was irrelevant. And to try and have a conversation about that. And it's important to remember that you might not be able to go through the whole ACTION in one go, but to split it up. So you might do the ACT and then the ION. And the next steps, this will depend on your role. So whether you're the manager, a leader, if you're a colleague, it might be less appropriate and you might decide to say something like, well, I think it's really important that we all reflect on this and what could we all do differently going forward? Or if you have a question like that, what would be a useful way for you to find out without asking that individual? So this is just, again, to think about bigger. And I've used an example about race. It could be any area. It could be assumptions about LGBTQIA+. It could be around religion and belief. It could be any area. So it's just really, I think, useful to, again, get people to understand what's happening. And don't forget about signposting to diverse services. I've listed a few here for you. And to consider any links that you want to create with organizations. Yeah, so I'll leave that there, and you will get a copy of the slides, or they'll be on the presentation if you wanted to have a look, to think about that. The other thing I wanted to mention, and it's not on here because I only found out about it recently, was a Sikh helpline. And I mentioned that specifically around what's happening at the moment with the farmers' protests in India. Now, it affects all farmers, but many of the farmers that are particularly affected are from the Sikh faith. And I know that the Seek Helpline are really supporting people. Many people are experiencing high levels of trauma and upset because they have family members there. But many South Asians who have a connection with India are very, very upset, and this is really impacting people. So I just wanted to mention that, as well as these other services. So just wanted to leave you with a few questions then before I finish and take Q&A. Any light bulb moments? Are there any obvious gaps that have become clear to you? And one action that you are going to be committed to take after this session? And just a huge thank you for participating and listening to me. I hope.
Actually, microaggressions are rife and can sometimes feel uncomfortable to challenge them. But I think this is so important going forwards. And the question is, how do you challenge these in a non-judgmental and sensitive way if they are not done with intentional malice, I should say?
Yeah, absolutely. And I think lots of conversations about this, because sometimes they're not done with malice. It is maybe ignorance or insensitivity, or people say, oh, I'm just really curious about people. I think it's maybe to preface it with, I realize that it wasn't done with any malice, or I understand that you really want to get to know our new colleague, or you were very intrigued by something that they said. I just want to point out something I noticed, or point out something that I saw, or that I recognized. And I think one of the things with microaggressions, or challenging them, or having these discussions, if someone flippantly says, oh God, that's so OCD, you know it's really important. And in an ideal world, it would be that adult to adult interaction, so that someone says, oh my goodness, I didn't realize. Absolutely, I'll take that on board. I'm going to apologize and it won't happen again. But that's not always the case, is it? Sometimes, depending on the organization, on the team, on the individual, not everyone has that emotional maturity, do they? And there is a sense of, I should be allowed to say what I want to say, or, well, I didn't mean it that way, so it's their problem, not mine. So it's about how do leaders and managers create an environment that is open and open and welcoming, if you like, to have those discussions. I think it's to preface it with, I realize this wasn't meant to be said that way, but I did notice this, or in order to have the most professional or most supportive working environment, I think, and in the sense of camaraderie and being a good colleague, there's something I'd really like to talk to you about. And then maybe adapting that action model and having that discussion, because what I noticed was they felt very uncomfortable, or I think the way you intended it and the way that it was received were different. What is your sense about that? I realize I don't know how helpful that is to you, and it is tricky. I do agree. But I also feel that actually workplaces can be in a sense, an easier place to have these discussions than a personal zone, because at least we have policies, procedures, and frameworks. Where we don't in the family zone, I think that can be more tricky. But I hope that's answered your question, and I hope that's helpful.
I think it was a great answer, Leyla, and I think you're exactly right. Using that kind of open language and asking those questions is just more conducive to an educational conversation, isn't it? Lots more comments in here around, there's another one here. Had never heard of the Black African Asian Therapy Network. As a therapist, this is really useful. Thank you.
Yeah, brilliant. I hope so. And they've got a great website. So yeah, check them out. And again, a question could be, do the EAP, do they reach out to them? Do they get some of those therapists on their books as well as the EAP?
There's another question in here, Leyla, actually from Rebecca, which is a great question, and one that I was thinking about asking myself, actually. The question is, what are your thoughts on the recent announcement that unconscious bias training is being phased out of the civil service?
Yes, thank you for that question. And I was speaking to a colleague yesterday whose sister works in the civil service, and she'd had a text from her sister saying, oh, we're not allowed to do it. So it is interesting. I think unconscious bias training needs to be part of a bigger picture. So I think it's one strand of a wider piece of work. It is interesting that research that's just been done on sort of sheep dip unconscious bias training shows little, or in fact negative, results, so that people don't take really ownership of truly thinking about what they're doing. So I think it has to be part of a bigger picture. I think it's strange that that's the thing they've chosen to phase out. I think that I would feel more comfortable if they'd said, we're phasing this out because we're doing a big piece of work and we're doing other sorts of training and we're thinking about critical race theory and we're thinking about social model of disability, but clearly that's not happening. I think the rhetoric that's come out about this is that, oh God, it's woke, it's really annoying, and we're going to stop it. So I think, given that that's the lens that it's being phased out with, I feel like it's appeasing. I feel like those messages have been sent out to appease certain groups of people and to send out a message that, oh, we're not wasting money on this anymore. I think I'd feel much better about it if they'd said, we're stopping this because this is what we're doing. But I don't think that message is coming out, and I don't feel that that is what's happening. So I think it's detrimental. I think it's sad, because I think there are many pockets in the civil service who've worked really, really hard, do a lot of work. And if we think about, the civil service 15 years ago, there was so much going on. And I know equality, diversity practitioners in the civil service work flipping hard. And this is very difficult, and I think this is kind of a threat to a lot of the good stuff that they do. Especially people think that raising intersectionality may dilute the importance of challenges particular groups are facing. Yeah, that's a great question. Thank you for that one. I think it's because I think, if we think about intersectionality, absolutely we need to think about race, we need to think about disability, but how can we really separate them? And often what people do as well is, particularly in conversations about race, in universities, I want to give the example, is you start talking about race and someone says, oh, but white working class boys have it really, really bad. Now, I don't for a minute think we should start making, there is a hierarchy, but to start emphasizing this hierarchy, who has it worse, who's more of a victim, or who's more disadvantaged. We absolutely need to be talking about socioeconomic disadvantage in the round, because that's huge and that's really important. And why do we have huge swathes of middle class, what's termed middle class families, using food banks? How can we ignore that? But I think we need to think about it. I think the way to phrase that is to think about, yeah, we absolutely want to focus on X group of people, but what about all the other things? And if we've got someone from a particular group and they have an impairment, which means they can't go to the shops or they can't access information in the way that they need to, plus they've got caring responsibilities, well, actually, we need to adapt our program even more, or we need to think about how we do things even better so that everyone feels included. That's how I would do it. And I don't know if that answers your question, but I think it's also to reframe that and say to people, but we're more than one identity. Yes, this is really, really crucial, but within that, there's always a plurality of experience. So there isn't the Black experience, the disabled experience, the female experience, right? There is that plurality and plethora of experience. And I think getting people to think about that in relation to business outcomes, service users, is the way I would approach that. And I don't know.